A new survey. A small majority of women in the U.S. believe an OBGYN visit is essential to their health. And most women have a regular hairstylist, but not a regular gynecologist. So joining me now to highlight why regular visits are so important is gynecologic oncologist Dr. Sharon Lewin. Thanks so much for being with us, doctor.
Thank you, Robin.
So let's talk about this survey. Tell us some of the key findings in this survey.
So this survey, which was conducted by Genentech and the Foundation for Women's Cancer, looked at over 1,000 women across the United States and found, just as you said, that women are more likely to see their eye doctor, dentist, even hairstylist than their OBGYN. We know that women prioritize their children, their family members, many other people in the family before their own health care. We also found that while 80% of the women were concerned about cancer, less than 10% of them actually had the opportunity to discuss cancers with their physician.
Okay, as a breast cancer survivor myself, I understand that OBGYN visits obviously are highly important, but for somebody out there who doesn't go every year, what would you say to them about the importance of those visits?
I would really encourage and urge women to see their OBGYN every year, even starting at the age of 21. You know, cervical cancers in the United States can completely be prevented with pap smears and even with vaccines against a virus called the human papillomavirus. So any of these early changes in the cervix can be detected and treated way before it turns into a cancer. It's also such an important time to talk about breast health, the importance of mammograms, to screen for ovarian, uterine cancer, colon cancer, just a really key time to talk about preventing these cancers as well as early detection.
Absolutely. And just how prevalent are gynecologic cancers? We're talking cervical, ovarian, things of that nature.
We do know that every 9 minutes in the United States, a woman is diagnosed with a gynecologic cancer. When we're looking at cancer in general, 1 in 3 women can be affected with cancer in her lifetime. So these yearly visits are so important to help prevent cancer and really for women to talk to their doctors about what are their risks for these cancers and what can they do to modify or change these risks to live a healthy lifestyle.
And how do you suggest they start that conversation? Because sometimes that is the hardest part in this.
It's so true. I just really encourage women to be advocates for their own health care, really empower them to feel comfortable saying, am I at risk for cancer? What cancers am I at risk for? How can I change those risks? There's so many things that women can do. We know, for example, that obesity has been linked to uterine and ovarian cancer, as well as breast and colon cancer. I can't stress enough the importance of a healthy diet and exercise and really maintaining a healthy body weight. But these key screening programs like pap smears, mammograms, colonoscopies are absolutely essential. So I really want to empower women to ask their doctors what cancers they could be at risk for and really how to prevent them.
All right, doctor, and where should the ladies watching this today go for more information on everything you talked about?
The Foundation for Women's Cancer.org is a wonderful website that talks about the signs and symptoms of these cancers, as well as how to treat them and certainly how to prevent them.
All right, great advice, important advice. Thanks for being with us today.